Good morning, guys. So we are going to start with eye instruments, and they are used in ophthalmology practical. So let's start with them. ठीक है. Now I'm going to talk in English. ठीक है. If you want that I talk in Punjabi, then you can just message me, or you can write in the comments. ठीक है. Now we are going to start with instruments. So the first instrument you are going to learn about is superior rectus holding forceps. Superior rectus holding forceps is used in the cataract surgery, in glaucoma surgery, to hold the superior rectus, right? And you will see that the ends are not actually blunt, they are sharpened, and they have a teeth. ठीक है, they have teeth to hold the superior rectus. ठीक है. Now next is suture tire forceps. Suture tire forceps, these are, now you will see that distal end first. ठीक है, these are forceps. ये body सबकी same है, everyone has the same body, but where's the difference? The difference is actually the distal end. The distal end is actually slightly curved and it is sharp, so it holds the suture end during tying sutures. ठीक है, so it has to hold the suture end and hold cut ends of suture during its removal. So it will hold the cut ends of the suture during its removal, so it's like a supportive system. Next is McPherson forceps. McPherson forceps, they have very sharp angle, right? So they have very sharp angle, and the ends are also sharp, right? So this is for the intraocular lens holding placement in posterior chamber. So for the placement of intraocular lens, we use this McPherson forceps, and to remove the loose anterior capsule after completion of capsulotomy. So to catch or to remove the loose anterior capsule after completion of capsulotomy, we use these forceps. For suture tie during suturing with 10-0 nylon, we also use these McPherson forceps. Next is capsular rhexis forceps. Capsular rhexis is my favorite one. Why? Because the angulation is there. The ends, they have a bend, so this type of bend. So why this bend is there, you will get to know what work they do. So this bend is to perform continuous curvilinear capsular rhexis in case of manual SICS. If you want to study about cataract operation, what is capsular rhexis, then you have to go see my another video on the cataract surgery. Now chalazion clamp is this, and it is used to fix the chalazion and ensure hemostasis. So what it is used for, see, this thing everyone remembers. Where everyone is confused is capsular rhexis forceps, which has this bend. McPherson forceps, very good angulation, and and this distal part is long. And this suture tie forceps, there is angulation, which is smooth angulation, and this distal part is not this distal part is not very long. And in superior rectus holding forceps, you can see that this shape is there, right? This kind of U shape, something like that is there. So here you get confused, and you have to remember these. This chalazion clamp is used to fix chalazion and ensure the hemostasis, and to give intralesional, you will hold the chalazion with this, right? And to give intralesional injection of steroids in chalazion, and after fixing it with the forceps. Chalazion scoop, this is scoop, and when you will use the chalazion, and you will scoop out the chalazion using the scoop. So both of these, they are used simultaneously to scoop out the granulation tissue after giving incision on the chalazion, and must be complete scooping out to decrease the recurrence, right? So this is very important as an ophthalmologist. Appellation forceps used in trichiasis, in which the misdirected eyelashes, so girls might know this epilator. So this is used to pluck out the eyelashes, right? And this is also used to remove the foreign body. The salon people, they also might use this. Adherent mucus removal also. Pierre-Hoskin forceps, this is also my favorite. See, this has little this kind of angulation, right? See, like this at the end, right? So you will get to know that this is Pierre-Hoskin forceps, right? So these forceps are used in glaucoma surgery, cataract surgery, corneal and scleral grasp, and suture manipulation. So basically, this Pierre-Hoskin forceps is used in suture manipulation. Artery forceps. So artery forceps, these are these can be straight, these can be curved, these can be strongly curved. So these are serrations. And why these have serrations? Your brain knows, because to hold the artery, to hold the lid stitches, SR stitch, hemostasis, and DCR DCT. DCR DCT, they are mesenchymal sac operations, and Fancinus Servet operation in ptosis. And hold the muscle stump during enucleation, irrigating cystostome, and hold lacrimal sac prior to excision in DCT. ठीक है. Intracapsular forceps, these have a notch. So intra से याद करो, you have to remember that intra means कि ਇਹਦੇ भी intra which कुछ हैगा, means कि this intra means something is intra also in the instrumental itself. So there is a knob like cup, so that is intra. ठीक है, used in intracapsular cataract or extraction. So we remember this with this mnemonic. And next is tooth forceps. You all have seen in D hall, dissection hall in anatomy, grasping tough tissue, wound closure, handling specimen, counter traction, right? And eye speculum is very easy to identify, nothing like rocket science or something. Universal eye speculum separate both eyelids for good exposure. So this is going to separate, right? And used in squint and pterygium surgery, and sclerocorneal splitter. So you have these three things. We have side port blade, we have V-lance MVR, and we have sclerocorneal splitter. So when you see this MVR, this is actually very sharp. This sclerocorneal splitter is not very sharp. It has like sharp ends, but the distal end, very distal tip, is actually blunt. It is used to make sclerocorneal tunnel in manual SICS surgery and phacoemulsification also. And it is used in lamellar dissection of cornea and the lamellar keratoplasty. So V-lance blades or MVR, this is used in making side port entry at the limbus. So if you want to make side port entry at the limbus, then you are going to use V-lance or MVR, and these are actually straight, right? These are bent. See, these are straight. Now side port blade, the name itself says the side port. Side port means on the side. It will have a sharp end, and it is a disposable blade, yes, and maximum width of blade is 20 gauge needle, which can be used. 15-degree angulation is there. Phacoemulsification during cataract surgery. Thermocautery, the ball is heated, pointed tip is applied to bleeding point for hemostasis. The user is to cauterize the superficial bleed, bare sclera, area in the pterygium surgery, margin of the progressive corneal ulcer, small iris product. So this ball is heated, and when it is heated, then it can be used for the hemostasis. So this heat will travel through conduction to the tip, and then we use it for the hemostasis to cauterize superficial bleed, bare sclera, area in pterygium surgery, and margin of progressive corneal ulcer, small iris prolapse. In all these operations we use this. But nowadays the electric cautery are seen. Most of you know that in any surgery OT you can see that cautery being used. An intraocular lens dialer. So there's this Sinskey hook. This is fine hook. See, like this. Okay. This is a very straight. This is dialer, an intraocular lens dialer. So you will see that intra means that it has something like knob, like fine hook like structure to dial the intraocular lens for centration. Next is vectus. Vectus is ring of wire at distal ends. Okay. There is this ring, and this is used to remove the subluxator dislocated lens. So you will remove the lens using this vectus and deliver nucleus and ECCE with irrigating vectus. Irrigating vectus is tip. The tip is small. It has small 3 to 5 small openings. It's not 3.5. It's 3 to 5 small openings. See, can you see here? Yes. So ringer lactate, BSS bottle, create hydrostatic pressure, and same time mechanical pull by the vectus help to pull nucleus out. Okay. Next is irrigation aspiration. So this is the irrigation aspiration, and this is a two-way cannula, and this is used during surgery for irrigation and aspiration. Very, very, very easy to identify. Why we use irrigation aspiration? So that to clear view side by side, and clear the fluid, so that our view of surgery of the surgeon is very, very clear. Next is lens expressor. Lens expressor or the lens hook. This is the lens expressor or the lens hook. So you will see this. So this is flat corrugated handle with curved olive pointed blunt tip. So olive pointed blunt tip. IOL manipulation, dialing lens and nuclear rotation, stabilizing the eye and iris retraction. Guys, you don't have to miss out the remaining videos. Just be with me, right? I'm here for you and you are there, and you are going to listen and you are going to actually get good marks in the coming practicals. So let's join our hands and just remain in this video. Do not skip. Strabismus hook, this is strabismus hook. See, okay, so this kind of, we are going to learn this with the help of mnemonic. S for strabismus, like this S, some S kind of bend is there. So squint hook or muscle hook, use this is for the hook extraocular muscle, and squint operation, retinal detachment operation and enucleation operation. For the hook extraocular muscle, squint operation, retinal detachment operation and the enucleation operation, we use this Kelly's punch. So this kind of, this like punching kind of thing, this is Kelly's punch, and is used to create a trap door after making a scleral flap. So you make a scleral flap and you have to use this to make a trap door. This is corneal trephine, and the ends, these are actually circular, these are blade. Okay, blade to cut donor and recipient corneal button in keratoplasty, guys. Lacrimal probe, you will see that both the ends, this number is written, it means it has different diameters and it is made of stainless steel. It also known as Bowman's probe. And the uses are to probe the nasolacrimal passage in congenital punctal stenosis and in congenital dacryocystitis. So you use this probe to probe only, right? Next is Kerrison bone punch. The Kerrison bone punch is it has a spring handle, and this punch it is used to punch the break the bones in the DCR operation to create bony osteum. Right. Next is cat's paw retractor. Then this retractor, like cat's paw retractor, you have to use this to retract the subcutaneous tissue. Both these ends are used to retract only. Retract the subcutaneous tissue ligament during lacrimal surgery. Also, it is used in other plastic operations of the eyelid. Next is venous scissors. So these venous scissors, they are straight angulated and smaller, and it is used to prepare the conjunctival flap cut, right? So for preparation of the conjunctival flap, used to prepare conjunctival flap, cut 10-0 sutures in cataract or keratoplasty operation, and cut trabecular flap in trabeculotomy, cut anterior capsular tracts in ECCE, cut iris, straight angulated and smaller. So these are venous scissors. Okay, and they are mainly used in cataract or keratoplasty, in trabeculectomy, okay, in ECCE. Okay, wait a second, what is this? Next is corneoscleral scissors. So corneoscleral scissors, you can see this angulation. It is used to enlarge the corneoscleral incision for the ICCE. See, okay. So this is used to enlarge, and these are actually smaller. These are straight and angulated, right? But these are bent at the ends also, okay? And these are angulated, but these are bigger. Okay. Next is lid retractor. हेलो हाँ जी, ठीक है, हाँ आवांगी। Next is lid retractor. Sorry guys, lid retractor. So this is you will see that this is used to retract, and it is used in examination of conjunctiva and anterior segment of the eye, find out any abrasion, ulcers, foreign body on the cornea, and it is used in children and non-operative patients. It is used in photophobia, is used in severe blepharospasm, in lid edema, guys. Okay. Next is Castrovicius caliper. The markings are in mm, and it is used in SICS, and it is used for measuring the length and for the size of cornea. Next is Baracker needle holder. guys, wait a second, I have not written what is the use of bracker needle holder. ठीक है, I am telling you. So guys, it is let's write it is used it is used for the keratoplasty. It is used for keratoplasty. It is used in cataract surgery to close incisions. ठीक है. And in keratoplasty it is used for suturing. Next is it is also used in glaucoma surgery. In glaucoma surgery to suture trabeculectomy flaps. Okay. And last but not the least, scleral bulking. ठीक है. So this was all about the lecture. Thank you guys.